We're going to begin, and I'd like to welcome folks to the second day of our Peace of Mind Conference. And for those for the first time, welcome to our Peace of Mind Conference. I'm Dave Clark, and I'm the chairman of the Behavioral Health Alliance here in Amarillo in the Texas Panhandle. So welcome, and we think you'll really enjoy this morning with some esteemed panelists talking about resources for you as a community. Just a few things that we want to kind of talk about, and this is something that we're real proud of, and that's our report to the community. It's on our website, panhandlebehavioralhealthalliance.org. I'm going to refer to that a couple of times this morning, but what I want to refer to is our vision statement. So if you really talk about what we're about, this is what we're about, folks. We envision a Texas Panhandle which promotes behavioral health and wellness where all people have access to high quality behavioral care when and where they need it. So that's what we're about, and that's what we're about today. And we're going to have some great panelists talk about resources and how to get into the system, so to speak. I really want to thank a couple of great sponsors, and that's Excel Energy Foundation and Amarillo Air Foundation. Those are our two big supporters of our Peace of Mind conference this year. But we've had some others that really provided important support. Let me name those for you. One is Panhandle PBS, and the recording that's gone on yesterday and today has been recorded. Just to remind you to get full credit for your CEUs, it had to require being on board all day yesterday and at least through half of today. The United Way of Amarillo Canyon, obviously we're here at the headquarters today, and we really appreciate all they've done for us. West Texas AHEC, which is Amarillo Area Health Education Centers, and they're providing our CEUs. So thank you very much for doing that. Amarillo College and First Presbyterian Church. So thank everybody for helping us put this on this year. It's been a real challenge. We've got two great navigators behind the scene, which is Sheree and Charlotte. This would not be possible. So we're going to pose a question on the screen, and we'd like for people to take a minute to answer those questions. And we can't see you, but you can see us. So it gives us an idea of who is joining us today. So if you've attended both days today, check that. And if you're unable to attend day one, but will watch the recording, check that. So kind of take a minute and go through there and check that. And that will really help us a lot, get an idea about our conference and how we can improve this for the next year. So just for a second, let's take a look at it. It looks like, wow, nearly 80% of everybody that's attended today has been with us yesterday. So thanks for returning, guys. Just a second more and off we'll go. Great results, thanks. Looks like just cap that is most people attended day one and are with us day two. And the next is that a lot of people have checked that they will attend the virtual resource fair and meet the artists and peers later today. So we'll talk a little bit about that. So thanks for showing up today. Well, we want to talk about our first session. We want to spend time with everybody talking and me doing less. So let me kind of talk to you about the panel. There's really three important things that you should be aware of in our conference. First, it's being recorded. So people will have access to that. Second, we want to just make a note for everybody that those that have chosen to be our panelists are not going to give professional opinions. So don't box them up into a corner and get them to treat you. They'll gracefully say they won't be able to do that, but we'll be able to provide resources for you for questions you may have. And third, if you have any kind of problem with the conference, that would include me most of the time, you can always go to our chat box on the bottom of your screen and send out a message, and we'll try to help you through the Zoom conference the best we can. Well, I'm going to go in and introduce our panel. That's going to be really, I'm going to introduce Marge, who is going to lead our panel. So let me rephrase that. Marge Netherton. You know, there's a lot to be said about Marge. And I guess one thing I didn't know is that she had a member of her family that experienced mental health issues. And so this is really very dear to her and very close to her heart. Marge is also a professor of English at Amarillo College, and she has written a book called Moving Towards Joy, a self-care workbook for caregivers of loved ones with serious mental illness. So that's impressive. And so I'm anxious to read. I had no idea that she had written that, so I'm anxious to read it myself. Big thanks for Marge. She is passionate about mental health, and she helped reestablish the Texas Panhandle affiliate of the National Alliance of Mental Illness, and most people refer to that as NAMI. So I'm going to kind of scoot out and let Marge come in and introduce our esteemed panelists, and off we go.
Thank you, Dave, very much for that welcome. Welcome, everybody, to our Ask an Expert panel today. Thanks for being here. It's so important to support mental health in the Panhandle, and we're glad all of you have joined us. And thank you so much to our panelists for being here, taking time out of your day to talk to us about mental health. Just attendees, so you know how this works, you have a little Q&A tab at the bottom of your screen, and you can submit questions to us there. We will try to get to as many questions as we can during about an hour that we're together. And as Dave said, we can't answer individualized treatment questions, but we can answer more general questions about mental health, about addiction, about domestic violence, about youth and family health, and questions like that. So feel free to ask a question in the Q&A tab at the bottom of your screen. All right, I'm going to introduce our wonderful panelists here today. Here we have, you might want to raise your hands, everybody knows who you are, Jennifer Hale. And Jennifer Hale works with AISD as a student and family advocate. And I didn't know these existed until a few years ago. I wish I had known that our school system had mental health advocates. I think that's wonderful. And she is certified by Texas Panhandle Centers as a qualified mental health professional. She provides mental health services, and she has been to AISD for the past 12 years. So what she does, she and her team, they perform assessments, they refer and provide life skills, they do in-school counseling, and they offer support for students and their families. And this is through many methods, by phone, online, and in person. So welcome, Jennifer. Thank you for being here with us today. And then over here, we have Amy Stark, Dr. Amy Stark. And Dr. Stark is an associate professor of psychiatry at Texas Tech University Health Sciences Center. She is board certified in both general and addiction psychiatry, and she provides psychiatric care to an underserved part of the great state of Texas. Isn't that the truth? Do you know that we have 185 counties in Texas that have 0 psychiatrists, none at all? So we're very fortunate to have Dr. Stark and our other psychiatrists up here in the Panhandle with us. She comes highly, highly qualified. She received training at the Mayo Clinic, where she was chief resident. She completed specialty training in addiction psychiatry at Yale University. She has several publications. One of them concerns me a little bit. It's about burnout. So I hope we're not burning you out too much up here in the Panhandle, Dr. Stark, where we're underserved. And then she has also been recognized as an outstanding educator. So we're very pleased and honored to have Dr. Stark with us today. And here we have Kathy Tuttorio, and she received her bachelor's degree in psychology from California State University at Fullerton. She received her master's degree in psychology from West Texas A&M. And she is currently the director of crisis services, working with Family Support Services Crisis Department. And she assists victims and survivors of both domestic violence and sexual assault. And so we're very grateful, Kathy, for you being here and for the work that you do that probably is more important than ever during the pandemic right now. So welcome to all of you for being here. And the first question I wanted to throw out to kind of get us started and to give people time to ask questions is, what is the most important thing you wished your clients knew before they came to see you? Wouldn't it be nice to give them a reading list or a to-do list before they came to see you? Who would like to address that first?
I'll go ahead and go first. I I don't know that there's anything specific, although maybe the biggest thing when it comes to domestic violence and sexual assault is for people to know that we're here, because so many people don't know that this is a type of service that our agency provides. Oftentimes they only get that information when they have had an incident, have had a devastating event occur, and so then they get resources. But the other thing too is that just knowing that, first of all, our services of advocacy to victims and survivors are free of charge. We're grant funded, so those services do not cost anything. And then additionally, for undocumented victims, there's such a fear, a terror really, of threat of deportation and losing their children that they're afraid to ask for help from anyone. And we're not a policing agency. You know, we work in conjunction with many agencies in our area, but if someone needs help, our help to them is confidential. We don't make reports to any, ICE or anything like that. People can call or come in and not even give us their real name if they need information. So this needs to be known. Family Support Services needs to be known as a safe place to go for help.
Thank you so much. And we are going to be sharing, if you all are curious, contact information for all our panelist organizations toward the end here in the chat. Crisis hotlines, contact info if you want to use these services. Thank you. Who else would like to address that?
I was just going to jump on that last thing you said about not being a policing agency. That's something that's near and dear to my heart as an addiction psychiatrist. People come in and they're really scared to tell me what they've been using if they're illegal substances, and like 100% not a cop. My job is not to get anyone in trouble. My job is to help people. So I would like people to know that they can come to me unafraid, open, and honest when they really want help, and that when they open themselves up to be vulnerable like that and share, that's how we can really help them.
Thank you.
I think in the school, it looks a little different. Our students have fear of confidentiality, not only for what their teachers might hear or what their peers might see. And so that's really important, that I want students to know that we keep things very confidential. When a student comes out of the hospital setting and back into the school, we want to make sure that transition as easy as possible. And so we keep that confidential unless that's something that they want us to share. And so we try to have that working relationship with students of what you have to say is very important. I think they feel like they get overlooked because they're minors, and so their parents have the say of everything. But in the school, we want them to be able to have some say of what their treatment might look like, how we can help them in the school setting, because this isn't just about mental health help for them, but it's also about education and making them successful past school, past high school.
Great information. Thank you all so much. I think you've reassured a lot of people out there that you're all here and ready to help no matter what someone's situation is. So that's important. It's important. All right, this is a question that was submitted to us. And there's kind of an intro and then it ends in a question. A recent study at Boston University has revealed that clinical depression has increased threefold during the pandemic. This may be due to isolation and anxieties about the virus. How can providers mitigate the negative mental health effects of the virus when working with mental health clients? And this person says, what are some creative workarounds to help mental health clients have that human connection and not feel alienated? Who would like to address that?
I think we can speak to that a little bit. In the school setting, we've provided our virtual kids that for whatever reason aren't coming back to campus right now, two different options, either with our program through our counselors or with a different program called Dial Care. So both of those would be teletherapy that can be provided free of charge for students within AISD, CISD. I know that they're also doing, their advocates will see their kids virtual too. And I'm sure Highland Park, our advocate there, would do the same as well. So we did have to be creative during the quarantine at first, but trying to reach out to those students, phone calls, FaceTime, texting, whatever we could do to make those connections and try to make it as weirdless as possible.
Thanks. Anyone else?
We had a pretty immediate switch to telepsychiatry at the beginning of all the issues here around March. And that's been, I'm kind of tired of it, honestly, but it's been a wonderful way to be able to stay in touch with our patients. And I hope that moving forward, especially with what you brought up about so many underserved counties in Texas, that we'll be able to maintain a telemedicine clinic a couple days a week, maybe for people who live far away or who have mobility issues, because it's really broken down a lot of barriers to care for people. But being able to stay in touch with our patients that way, I know a lot of the support groups in town, peer support groups, AANA, LGBTQIA support groups are all meeting via Zoom or another video sharing conference. And that's been really good for people to even stay connected just by video, even though it's not, you know, being able to go to those groups and hug the people that you see and miss. It's still a huge link out to the rest of the world when we're so isolated. So I think telemedicine's been really an important piece of this puzzle for us.
I agree with that.
If I could jump in there too.
Go ahead. Go ahead.
I was just going to say that, you know, the online, the virtual ability to meet has been tremendous, certainly for our counseling division or mental health and wellness division. But that's something that advocates for domestic violence and sexual assault had to jump into right away as well, with the concerns about person-to-person exposure. And so we've done a lot of communication through the telephone for questions and things like assisting with crime victims compensation and that kind of things. But we also put our support groups online. And it, regardless of how hard we try, it does take away some of that personal connection, because I miss some of the interpersonal things that we did in person. But it's allowed for quite a few people to attend our groups. It's also allowed me to reach out to people who, even if they choose not to attend, they've been referred or they initially were interested. So now I've got their email address. And so I send them to the link. And if they choose not to attend at our night's discussion, the next day I will send them the information that we've covered. So even if they're not interacting with us, they're getting additional information that might be useful, that might pique an interest, that might simply plant a seed so that in 6 months or 12 months from now, when they really feel like they need to talk to somebody, they know that we're there. And so that's been a positive advantage to how we can do things. But honestly, I agree with Dr. Stark that I really prefer that interpersonal interaction, and virtual is great for what we have to have for now, but I look forward to the day when we can actually start coming together again in person.
Thank you. It sounds like you all have adapted in so many creative ways already to serve people who might be isolated. And it makes me hope, you know, that I know a lot of the services some of y'all provide are free. I know Family Support Services was providing free counseling right when the pandemic broke out. But it's also nice that insurance, am I correct, is covering some services like psychiatric visits that are online, and hopefully that will continue after the pandemic, you know, that these will continue to be covered for people, you know, especially in rural counties who have trouble driving in and receiving these services. So hopefully some of the creative workarounds that we've established during the pandemic, we can continue, you know, after the pandemic as well. Okay, someone asked a question. Given the rise in addiction rates due to isolation, members may be more likely to drink alcohol, abuse illicit and prescription medication, etc. Much of this would occur, quote unquote, in the closet and in COVID isolation. What are some options we can use to open that door? So this person is concerned about addiction issues increasing during the pandemic, and people who ordinarily would be in those people's lives, you know, are not noticing as much. And that could be true for adults as well as students. Any response to that, what we can do to try to reach out, or if we notice something, to people who might be experiencing more issues with addiction right now?
I'll go first. So one of the most important things you can do when a loved one or a friend is suffering with, whether it's a substance use disorder or any other psychiatric illness, is just let them know that you care and that you're there for them. Substance use disorders are so tough as the person, the support person, seeing someone using or drinking more. And if they're not ready to have a change and you just want to fix it for them, that's not going to go the way you want it to go. So making sure that the person in your life who you're concerned about, who might have had an uptick in their drinking or their drug use, first of all, you can say, hey, I'm concerned about you. I've noticed that this has changed. And these are the ways that I see it impacting your life. These are the way I see it impacting your relationships. There's help out there. Can I be part of this journey with you? Can I help you? And for a lot of substances, therapies are just as valuable as medications, sometimes more for specific substances. If there are really important, a lot of docs don't talk about this though, there are medications that can help you with alcohol cravings, with opioid cravings, to help detox you if you need to be detoxed, so that you don't really have to go it alone. So friends and family members, one, let your people know that you're there, that you're concerned, that you love them no matter what. And two, that you can help connect them with help. If you think it's something that requires medical attention, primary care is an excellent place to start. If you think it's something that requires, sober peer support, AA, MA, Celebrate Recovery, Smart Recovery, there's a billion of them here in town. So reach out and let people know that you're there and offer what help and see what they accept. Don't force help.
Thank you. Anybody else? Well, let me put a little bit of a spin on that. That was more specifically about addiction, but also, I've heard that domestic violence has been called the pandemic within the pandemic, that it's really increased with, isolation, enforced isolation, with, economic issues, childcare issues, that, there are surging numbers related to domestic violence. And Kathy, what would you advise someone if they think that someone is a victim of domestic violence? What would you suggest to them?
I would say, first of all, that victims of domestic violence, still in the throes of that within their family, are much less likely to talk about the fact that that's going on, because there's so much, it thrives in secrecy. They're so humiliated that it's happening to them. I don't know if you all are seeing the ads on Facebook and on television now where the woman's talking on the phone or talking virtually and she does this, and now that's a signal, I need help. I mean, he's being violent with me or she's being violent with me, which I think is an interesting thing, just an added way to ask or seek for help. But what I tell people is, if there's a suspicion and you're not even really sure, and you don't know how that person's going to react to what you say, if it's going to be warm and thanking, or if you're going to be attacked because you made an assumption. But that simple statement with regard to any concerns: I'm concerned about you. Are you okay? Hey, I'm available to talk. Here's my phone number. You know how to get a hold of me. Call me anytime. Those open doors, even though people might be very reserved about opening themselves up, those very simple statements, so that that person knows that they've got a contact, that somebody cares about them. Because being isolated, those victims are often told, nobody wants you, nobody likes you, I'm the only one that loves you, those kinds of things. So the more that friends or even just acquaintances notice things and say, I'm worried about you, are you okay? Is just a very simple statement. Call me anytime. And then mean it, mean it. Don't say it if you're not going to be willing to sit on the phone for a half hour when they call you at 10 o'clock at night, because that may be the only connection that they have. That may be the only moment they have to call somebody for help. So that's what I would say.
Great, thank you. And thanks for, I've read about that. Can you show us that signal again? I've read about that. I hadn't seen it.
It was brand new to me. I hadn't seen it, but it's when somebody might just sort of subtly thumb into the palm, fingers over the thumb. And I honestly, I don't know where that comes from. Like I said, that's new to me. But if people are aware of it and they see it, then they can maybe make a call, do something about it.
Thank you so much. And Jennifer, speaking of all this isolation and maybe being cut off from usual support systems, have you seen an impact on school kids and maybe their families with all the, isolation and being at home and having to often, go to school from home and just being cut off from friends? Have you seen some impact or just anxieties in general about the
Right.
pandemic?
Yeah, I think that's what we've seen the most of is anxiety and increase in their depression, those that already suffer being isolated. And for a lot of our students, school is their lifeline. It's their outlet. Obviously teens connect with teens better than they do with adults at certain parts of their life. And so having that taken away has been very difficult for some of our students. Anxieties are heightened. Now there's new programming in the school for grading and turning in and things like that. So the anxieties are out of the roof right now. So, but we're there to support, and I think our teachers are really good about seeing those things in students and being able to refer to either us, their school counselor, the school administrators, and being very helpful to see some of those things. So.
That's good to know. And just recently, some people might not realize this, just recently, now all public school teachers in Texas have to get some training to recognize mental health issues. That was a recent, NAMI helped to bring that about, but that's a recent change in Texas that teachers do receive that help and that training. So thank you all for the work you do there. Let's see, we have a question for Dr. Stark. Do you think the field of psychiatry is doing a good enough job, including trauma-informed approaches when treating patients?
I sure hope we're all trying. I think just like anything, you're going to find docs who have areas of specialty who are more, that's their wheelhouse. They're more informed on that kind of a thing. But I think what's so important with trauma and, kind of my background in addiction, I feel like if you're not assessing trauma, you're not doing it right. Because it's all so intertwined, psychiatric diagnoses, histories of trauma, and substance use. But when I've got patients who come to me in established care and they've got a real clear history of whether it's acute or whether it's chronic complex, but they've got a trauma history, one of the things that we talk about is psychiatry can't do as much for you as maybe some other psychiatric diagnoses. We don't have great medications for trauma. There's a little bit of support for some of our antidepressants that they might help a little bit, but what's going to make the difference in treating patients with trauma histories is therapy. You don't get to skip trauma. You have to process it. You got to go through it. So right now, my practice is largely medication management. So I don't get to do any really therapy approaches. So my goals for those patients is I've got to convince them, one, that therapy is going to be where the money's at for them. And two, to get them connected with the right person in the community that they're going to feel comfortable being open and safe with. And that this person that I connect them with is going to be providing an evidence-based therapy for trauma, cognitive processing therapy, EMDR, anything that would be able to help them. So I do think psychiatrists are aware of their limits regarding how much we can do and what our piece of that puzzle is. And I do think, from my perspective, from my colleagues' perspectives, the folks that I work closely with, we push really, really hard to get people into evidence-based treatments, whether that's medications or therapies. Meds aren't for everyone. It's not my job to give people medications when they don't want to be on them and when they don't work. So I think we're doing a good job. I hope we're doing a good job. I feel like the way that question was phrased was maybe you want us to do some more, and I'm all ears. So feedback always welcome.
And I think thank you, Dr. Stark. And I think I've seen that more and more counselors in town are getting trained to be, is it called, trauma-informed counselors. So we are, I think, improving from what I've heard in that area, that we're getting more specialty training in trauma, because you're right, it is needed.
Can I jump in there also?
Sure, yes.
Certainly as a licensed professional counselor, I'm seeing so much more of that over the last several years. and maybe even before the title was starting to be used, that was really the goal. We have to meet the client where they are. From an advocacy standpoint, from our emergency shelter staff standpoint, we have to meet those clients where they are. So even if we don't know all their trauma, we get a bit of a story. We know they're terrified. We know that they've been diagnosed with PTSD. And so we have to be very sensitive about what their triggers are. The more we know, the better able we are to be very sensitive to certain things, but oftentimes we don't know. So we simply have to meet them where they're at. And so, for instance, like a domestic violence victim, if they come in and they're talking about the raging violence in their home, but they've made it clear, I can't leave. You know, I've got this and this and this. I'm not ready to leave. I've got to make the plan. We have to meet them where they are, even though we might be terrified that this is their last week. We don't say you have to leave. We say, okay, what's going to make you safer? What can we offer you? So we have to meet them where they are. And that's the basis really of trauma-informed care, is just understanding where they're at and being able to help them get there. And that may be an oversimplification, but from our standpoint, from the advocacy standpoint, that's how we have to approach it, because they're the experts on what they're going through. So we have to approach it from that standpoint.
Thank you so much. Let's find another question here. All right, this might be more for Jennifer. When it's teens reaching out to an adult for support and resources, how could non-school, non-family support the teen? I've noticed sometimes there's hesitation because of not knowing what liability a person has. That's interesting. So how can we help teens without any special training or worrying about doing the wrong thing? I think maybe they're asking.
Sure. Yeah, I think Dr. Stark and Kathy both spoke to this. Is just letting the young person know that you're there, that you support them, that you want to help them in their time, and that, you know, I'm waiting here with you and want to walk this with you. As far as liability goes, obviously in the school, if a student person ever says that they want to harm themselves or someone else, you know, the confidentiality goes out the window, and that's when you're making calls to parents or guardians. But for maybe a non-school staff, I think that you've got to be very honest with young people. They want honesty. They've got great BS meters, and they want to know how are you going to help me? And I've come to you with this. And so what can you do to help me? And to be able to say, I may not know, but we're going to find the help. And I'm going to walk with you to do that. And whatever it is that you need from me, I can do this for you. And just being very truthful and very honest of, this is what I can do. And if I can't do it, we'll try to help you find the help for you. Honesty goes a long way with our young people.
Thank you, Jennifer. Also kind of related to that, you know, our community offers mental health first aid training. You know, so many of us get trained in CPR, but mental health disorders affect 1 in 5 people, very common. It would be great to get that training, often free, in our community, just so you know what to do when someone is in a mental health crisis. So I would highly recommend mental health first aid, which PBHA sends out quite a bit of information about. Okay, let's see, another question here. Are there any coordinated efforts to address the mental health needs of senior citizens? Many individuals in assisted living, nursing homes, and senior living communities, as well as those living alone, are on the brink of suicidal crisis. That's true. It's been very difficult for people in nursing homes and assisted living who can't see their family members or be close to their family members. Do y'all have any thing to say to that question?
I think this is another area where telemedicine has been helpful for us. So many of these folks, most skilled nursing facilities, and I'm not currently working in any, so I can't speak to any in specific locally, but have docs that are there that round in person. And in light of the pandemic in the last 7 or 8 months, people have been much more sensitive to mental health needs, checking on those symptoms, because as isolated as we all feel, folks in nursing homes, folks in independent living facilities are even more isolated. So checking on those things. I know primary care docs and geriatricians have been very careful to be checking on mental health. It's a really, really sticky situation right now. And I think we're trying to keep our ear to the ground and be a little bit more sensitive with our patients to see if we need to be jumping in and offering any kind of treatment or evaluation. But I think a lot of what we're seeing is we just need to be approaching this isolation and what can we do to help these people feel more a part of their community, more close to their families, and those kind of things. I'm going to let other people speak to this because I know this is broad spectrum, everyone.
Anybody else like to add anything? I think that really speaks to integrated care, doesn't it? Which we're trying to promote more and more, that we shouldn't each just be in our silos, that primary care doctors need to be trained to ask about mental health. I think this is getting better, but I personally have had primary care doctors who've never asked in a screening, a health screening about mental health. And so I really appreciate it when primary care doctors do ask about mental health. And so I know we've been trying in our community to integrate that more so that they're not just all separated. You know, that's someone else's job. I'm going to be looking for mental health signs and symptoms too, even if I'm a primary care provider or whoever I might be. Here's a great question. Kathy, how are your providers at Family Support Services tending to their own mental health during this increased time of domestic violence? And really that could be extended to all our providers who are all overstretched, right?
Right. I would say that our team members and directors are frequently sending out emails to, hey, remember to take care of yourself, take some time off, take your PTO, don't be overworking, don't go overtime if you don't have to, that kind of stuff. But also recognizing that during particular times, and certainly now after, I guess it was yesterday's city council meeting where the report about the status of Amarillo and the COVID concerns right now are a little bit frightening. The idea that giving staff opportunities to work from home, if that's at all possible, and again, utilizing that telemedicine so that they can make sure to take care of their own health, because certainly some of us have been exposed. I ended up with it as well. I got tested positive, and so all of those opportunities where we can try to keep everybody safe, not just ourselves, but our family members. And now we have a program that, not domestic violence, but for sexual assault, we have advocates that actually go out to the hospital and the Children's Advocacy Center to meet with victims, to have in-person advocacy for every victim. And that's a state mandate. You know, they have a right to have an advocate there with them. And now we're looking at what's going to keep our advocates safest: masks and gloves and even face shields. And maybe there are some locations that are actually using an iPad to communicate instead of having live advocates now. And so there's a lot of things that we have to consider that's again outside the box, but having continuing conversations about what do you feel is going to keep you safest. And then of course my biggest recommendation is Star Wars and Harry Potter as frequently as possible. You know, do things that make you happy. You have to.
Would someone else like to add to that? Self-care?
Absolutely. So 100% on board for the Harry Potter. I'm a Hufflepuff, so 100%. So boundaries. Boundaries are so very important. And a lot of us in times of uncertainty either do too much or too little. We either throw ourselves into things and overextend ourselves, or we completely withdraw and we shut down. So making sure that you've got boundaries around work, around relationships, around how much you extend yourself, when and to who, so that it stays healthy for you. The last thing Kathy said about doing things you enjoy, that's an evidence-based therapy that we use for depression called behavioral activation. And it means making yourself do fun stuff even when you don't want to. So those are the things that we do to recharge our batteries. For me, it's, hanging out with my cats and playing Nintendo and calling my mom, doing those things that recharge your batteries so that you can keep going. There's also a reason why so many psychiatrists and therapists have their own therapist. It's because you have to have that outlet. You've got to have a place to process all your stressors. And I know I have a bias, but I say everyone should be in therapy all the time. I think it's super.
Well, you know, we have a saying in NAMI, it's kind of corny, but it's true. You know, they tell you on the airplane to put the oxygen mask on yourself first for a reason, because you can't tend to anybody else unless you tend to yourself first. So I've learned that over time. I believe it with my whole heart now, that it's true. You have to take care of yourself, or you cannot really healthily take care of anybody else. So, do we have another question, Charlotte? Let's see. We have a serious mental health provider shortage, as we said, in the Texas Panhandle. What are some steps we can take in the community, on the community level and state level, to bring more mental health providers to our area? And that is true, we do. I don't know that a lot of people realize that. There was an article recently written about that, how especially in the Texas Panhandle, we have some real shortages. We have waiting lists, shortages. I know not all providers accept Medicaid, for example, and so that's another wrinkle there. What do y'all think we can do as a community, and just on the state level maybe, to encourage more mental health providers here? Anybody? That's a big problem, I know.
I'll go. And someone asked a very similar question in the chat as well about retention of people that we're training in the area, new docs. And so, you know, that's a big part of my job title. I'm the Psychiatry Clerkship Director. So every third year medical student that graduates from Texas Tech on the Amarillo campus rotates through psychiatry, and they all learn psychiatry. Whether they all go into psychiatry or not is a different story. I try and sway them and poach them, but I have a limited success rate. But last year we had 9 students choose to pursue psychiatry residencies out of our campus of 60 in Amarillo. So that's really fantastic. The difficulty then is getting people to come on back home, to come to Amarillo to practice. And one of the things that as an institution, Texas Tech, and working on our state government level is trying really hard to do is create a psychiatry residency here. Yes. So that instead of having to go away to get your residency training, like I went up to Minnesota and got my training up there, if there had been a residency here in Amarillo, I might have never left. And what we know is that psychiatrists, 60% of them stay where they train. So if we can we got to grow first. We don't have enough manpower to start a residency yet. But if we can keep growing our department in an organic way that is going to get faculty that values education of our students, patient care, and research the same way that all of us here do now, then we'll be able to build a residency whose main mission is to create psychiatrists to serve our community. And even if they do go away, we're looking at 4 students per year. And so that would be 16 in training psychiatry residents to help the community once we get that going. So that's what we're trying really hard to do, but that's a long game thing. But I'm also just trying to trick the students into coming back anyway. So.
Bribe trick, yeah. And what about, aren't there psychiatric nurse practitioners? Would that be another option too?
Yeah, we have a nurse practitioner in our office, Liz Rogers, and she's amazing. And I think West Texas A&M just opened a psych NP program. Don't hold me to that. I heard that at Heal the City and was really excited about that. And that's we're seeing nationwide that that's a really good way to increase access to care. It's been really great to work with Liz, and we really appreciate all the help that we can get out here in the Panhandle. So.
Okay, one more question for Dr. Starr. Can you scroll back to that medication question, Charlotte? Dr. Starr, given some of the common serious side effects of psychiatric medications, could you give some suggestions on how friends and family members can be supportive of people experiencing the side effects?
Absolutely. So side effects suck. A lot of the psychiatric medications that we have like antidepressants, they're really well tolerated. And there are some that have relatively few side effects, but some of our bigger guns come with some big side effects. And so have to be mindful of those things. And one of the things that I always encourage my patients to do is be your own advocate. Ask your doc about side effects. If you've got a side effect, call me. Like, let's talk about it. There might be it might be transient. It might go away on its own. There might be something we can do to make you more comfortable. As a friend or a loved one supporting someone on their mental health journey, if they've started a new medication and they don't feel right, trust them. Number one, trust them. When someone says something's not right, I don't feel right, trust them. Encourage them to call their doc. Say, hey, why don't you? I would say avoid Google, but I mean, avoid Google with a grain of salt, okay? But call your doctor. And same thing that we've talked about all day, as a family member, as a friend or a loved one, the question, what can I do to help you, goes so far. Because sometimes people, will you just listen to me talk about this sweating that I have since I started Prozac? Like, I don't want to do anything about it. I just want to talk about it. Like, okay, I'll listen. Would you help me call my doctor? Would you help me, do X, Y, or Z? So sometimes we jump in and we want to do and fix, but that may not be what your friend or loved one is looking for. So first and foremost, being like, I hear you. What do you need from me? What can I do? So, but good rule of thumb, always call your doctor.
And it's frustrating, isn't it? Because so many of the psych meds take so long to work. And I think a lot of individuals and their family members don't realize that. And they might want to get right off of it, or it takes a while for the body to adjust to that medication. So sometimes it can take, 6 to 8 weeks even, right, Dr.
Yeah, it depends. So most commonly, the bread and butter psychiatric stuff, generalized anxiety, depression, gold standard treatment for those are SSRIs or our antidepressants, Paxil, Prozac, Zoloft, Celexa, Lexapro, all those. Those take 4 to 6 weeks to work if your metabolism's as expected. So it can take a while. And so I tell my patients, if in the first 2 or 3 weeks you're taking a medication and all you're doing is taking a medication and you don't notice anything, that's beautiful. I want that. That shows me that you're tolerating it. That's great. In another couple weeks, if you start to notice something, all right, we've got a partial response. We've got a little bit of an effect, and then we've got more data to go on, but it really does take some time for those medications to start working. And that's the effect that it has, chemically within our brains. And I don't think anyone wants to get into the weeds on that, but it's a longer process, and it takes some time for our brain cells to actually change the way that they transmit all of those happy neurotransmitters, the serotonin. So, I know it's so frustrating. You had to wait to get into the therapist, or you had to wait to get into the psychiatrist, and now you have to wait for a medication to kick in. But please don't get hopeless. Please don't lose hope. Please hang in there and keep trying it. And that's one of the things that I also, I'm a broken record, but I always recommend therapy. While we're waiting on this medication to start, you can be engaging in therapy, building up coping skills, processing some of this stuff that's weighing on your heart. And that helps. We know meds work. We know therapy works. We know they work better together. So.
Thank you so much. That's true. It's a hard journey, though, for everybody involved, isn't it? Very hard journey. And it can take several tries to find the right medicine. So it makes it extra hard. Do we have time for another question? Or let's see. All right, I'll end with this one. Dr. Stark, what made you want to practice in Amarillo? As maybe a clue to getting more mental health providers, right? And you all can address that too. Why here? What's keeping you here? What's good about practicing here?
I've never been a big city person. So when I came here for my clinicals, I was a tech med student. So you can tell my whole office is red and black, and we bleed red and black around here. And so I came here to Amarillo, and if you don't know my colleague, Dr. Jenkins, he's a psychiatrist who's been in this community for 25, 30 some years. And he's my mentor. And I knew that I wanted to come back and have really good early career mentorship. And so Dr. Jenkins was a big part of it. No traffic was a big part of it. Tech was a big part of it, so that I could teach and treat patients and not have to do as much research as I would have had to do if I accepted the job out at Yale. So, because I rather spend my time with my patients and my students than digging through data. So there were a lot of things that contributed, and my family's in Texas. So it was so important to me to come back home. I thought when I left for residency, like, I can go anywhere. I'm young and I don't have anything driving me down. And as soon as I left, I was like, I miss Texas and my family. And so I knew pretty much immediately I wanted to come back home.
Anybody else?
I would agree with Dr. Stark on that. Amarillo is a good place to raise a family. The school system's great. My son loves all of his teachers and has since he started school. And even though I'm a big city girl, my husband is a big city boy. And so we came back here reluctantly, but I have my folks here. But Amarillo's a nice place to be. And it's kind of central. So it's not too hard to get anywhere else that you want to go. So the environment's nice. The medical community, we have a good medical community. We've got sports, we've got things that are interesting for kids. I'd love to see more, but this is a very stable place to be, and it's comfortable. And if people want, like you say, we have not nearly enough mental health professionals here. So theoretically, there's going to be long-term job opportunities for people that are interested. So.
Great. Jennifer, did you want to add anything to that?
This program started about 12 years ago in AISD, and it was just a pilot program, and they got 6 people together from different backgrounds, and we all had to figure it out and how we were going to make it work. And so it's been a journey from day one. And I think we've really grown something that is sustainable and helpful to our students, and not only our students, but our families too. We see that these students come from families, and there's families that are in need, and we're able to use our community resources, whether that be Family Support Services, Texas Tech, the clergy, whatever it may be. We're able to put some of these puzzle pieces together because we have the time and help not only the students, but the families as well. And so I think it's unique. And, the Texas Panhandle Centers was able to branch out to Canyon ISD and Highland Park ISD, and hopefully into maybe some of the other smaller school districts around as funding is found, hopefully. Maybe that's the silver lining in the pandemic is some funding for something like this.
All right, I just want to thank y'all so much for taking the time to share all this wonderful information with us and let us get to know you all better. I don't think we're able to share all the contact information here in the chat, but we are going to email it to you. If you have registered for this conference, you'll be getting a survey, and we will share the resources and the contact information in that email. So be watching for that email. Thank you all so much for being here. It's been wonderful, and thank you to everybody who's joined. I think it's been a really fruitful discussion. So thank you. Stay tuned. Dave Clark is going to tell us how to join the virtual resource fair. We have some wonderful representatives of different mental health organizations in town, so you won't want to miss that. So I'm going to turn it over to Dave.
Just a real quick footnote to Dr. Stark and Jennifer and you, Kathy. One thing that's kind of run through my mind yesterday and today, we just had a great young lady yesterday and her mom, where she had really experienced anxiety, and I called her real brave. And I just want to say to you all that y'all are champions for us, and Jennifer, for what you do at the school district, and Dr. Stark, what you're doing in our community. We need you, and we need you involved in our organization. And Kathy, thanks so much for all you do. So this panel is a panel of champions, and we are so grateful for what they do in our community in the Texas Panhandle. So big thanks. And Margie, thanks for narrating that for us. Great job.